Good afternoon, everyone, and welcome to Know Your Customer, Patient, Healthcare IT Services Vendors, Ready Clients for Consumer-Driven Healthcare, highlighting the results of our recent Healthcare IT Services Benchmark. My name is Allison Crawford, and I'm your host for today's session. Over the past few quarters, we've engaged with our readers to bring deeper clarity into the state of the healthcare IT services market. We've had good questions and discussions as a result of these events, and we're excited to bring you additional insights into the business models and strategies that are shaping this market. In the next 30 minutes, analyst Joe Wallet will delve into the trends driving the results featured in this quarter's benchmark, followed by a Q&A of these trends and how they will affect you. Before we get started, I'd like to cover a few logistics. First, we're recording today's session and we'll be posting it to our YouTube site, TBRI channel. We encourage you to visit our channel to watch this presentation or any of the others that we've posted. Second, we'd like to hear your opinions and thoughts on the materials we're presenting. Please send any questions or comments to the Q&A or chat function. Joe will address them at the end of the presentation. Or if you'd like to set up a client inquiry for more detailed discussion, please reach out directly to either Joe or myself at the end of the webinar to set up that conversation. Third, we'll send the slides to everyone registered for today's webcast within 24 hours of the conclusion of the webinar. You can also find these slides as well as other thought leadership pieces, webinar decks, and commentaries on SlideShare at www.slideshare.net/TBR_market_insight. And we'll share all the social media links with you again at the end of the presentation. With that, let me introduce Joe Wallet. Joe is the HITS lead analyst and has been a linchpin in the program since the initial coverage of CSC. His insight into the performance of the HITS vendors is unparalleled in the industry, and his guidance has assisted countless clients with their strategic planning. And with that, let me hand this over to Joe.
Thank you, Allison, and hello to everyone online today. Just a quick overview of our overall HITS practice. We cover 18 vendors in the overall Health IT Services benchmark. Of those, we're looking at Accenture, CSC, Dell Services, HP, and IBM on a semi-annual basis, exclusively on their Health IT Services practice. And then we're also looking at 8 other firms that are in our more general coverage. So we have very in-depth knowledge of the companies that we feature in this benchmark. On top of that, we're also looking at the particular Health IT Service activities of several of the pure plays, Allscripts, Cerner, CPSI. We added Epic this past quarter to the overall coverage, and we'll be calling them out in several instances in the overall readout today. So with that, we'll move on and we'll take a look at what we're going to be talking about today. First, we're going to go through some of the key fiscal results we saw in the 4Q13, the last quarter of 2013. We're going to dive into some of the strategic actions taken by many of the HITS vendors during the quarter and their implications for the market going forward. And then we're going to take a look at some of the overall trends that we're seeing in the marketplace, as well as some of the hot topics that were being covered and discussed at the HIMSS 14 conference. And we'll have some time for Q&A at the end. So let's get started. And so overall, the whole market in Health IT Services is changing, and we're seeing a lot of actions being taken by the various companies to ensure that they can maintain their strong position in a market that is expanding, and when that's being juxtaposed to the larger IT services market. And we'll look at that a little bit more. So what were the recent fiscal outcomes? Well, we can see in this chart, and this compares both the average year-to-year growth of all the participants in our syndication, as well as the average TTM year-to-year growth for all. And we can see that it's a fairly consistent double-digit line at the beginning, and then it's starting to gradually move down as we come forward in time. Some of this is due to some large acquisition activity that took place in 2012, and that's being amortized or brought across the 2013 year. As that flows off, we're seeing some slowdown in the overall growth rate, but for the most part, this is a very strong and healthy sector in the IT services marketplace in general. More and more we're seeing more and more entrants, and also participants that are already in the health IT services market are upping their investment. Deloitte in particular is a company that has seized on health IT services as a true growth sector. Xerox is another company that is making investments to scale up its operations, and we'll get into that a little bit later. Overall, so we can see that the high single-digit growth at the end of 4Q13, and just to compare that to what we had in TBR's more general vendor IT services benchmark, which had closer to a 1.5% year-to-year growth for the vendors featured in that benchmark. So this is a highly attractive sector for participants, and we're going to continue to see increased competition. Now, on the other side of that, it's an expanding market. So as far as companies running into each other, there are some areas where there is contracts being contested for. The federal space is a good example of that. But the expanding nature and the fragmented nature of the overall market allows a great variety of IT service vendors to really enter into the space and make advances in their own revenue growth. So more to come on this in future reports as we continue to watch developments in this space. Now, this slide holds my favorite overall chart. It brings together three valuable pieces of information: the size of the overall health IT services practice for each of the vendors, how fast they're growing and how fast that business is expanding, and how effectively they are running that business with their operating income. So the size of the bubble is going to be the revenue size of those practices. Now, the standout we see, just quickly glancing at the chart, is CGI from a growth standpoint. Now, this is still largely to do with the impact of the Logica acquisition that they did in late 2012. Now, they did spread this across 5 quarters, so this will be the last quarter that they will be showing such a strong impact from that large acquisition that they did over a year ago. That being said, they also were the beneficiary of the large-scale project that they were doing for the federal government, healthcare.gov, and we all know how that went. We're going to see them seeing additional headwinds going forward as that contract migrates off and goes to the new IT services vendor, Accenture, to maintain and provide the steady upgrades to the healthcare.gov and the more general state-elected piece that's going on for benefit exchange. So what we're also talking about here is that we have Epic. We call that out, and their addition to the overall benchmark. This is purely representative of their IT services revenue, and we're estimating them in the leader category or outperformer category in terms of the growth that they're sustaining. And this has been driven by a very strict adherence to a very strong business model where they are focusing exclusively on larger engagements. And then some of the other companies that stand out, Cognizant is a good company where they look at the overall life sciences business that they're doing. That's been a strong area for them, and they're able to consistently deliver double-digit growth in a large business sector. And then Deloitte, as I said earlier, I think that this is one of the companies that needs to be observed by many of the market participants. They are making a full court press in this space and definitely moving forward to build out this as a key pillar of their overall growth going forward. Looking at some of the companies that, the larger players in the overall, IBM Global Services had over $1.1 billion in revenue for the quarter. Did show some contraction in overall growth, but consistently is one of the leaders in terms of, or is the leader in terms of revenue. And it's followed by HP Services and Xerox Services, both with strong, primarily domestically based engagements with the Medicaid systems across many of the states. And we see that that's going to be a growth area for them going forward. So expect them to be moving to the right in this chart in the coming quarters. A couple of the companies that were laggards, Harris continues to face problems as far as getting their overall health IT services business to gain traction in the federal space. This is something that's been going on for quite some time now, and it's in our estimation that if we don't see some positive revenue growth and some profitability from that, I don't think Harris will continue to keep a strong presence in this market, and we might actually see them discontinue their. Allscripts, on the other hand, while it is in the laggard category for this 4Q13 quarter, that's largely for a lot of the restructuring charges that they took in the past year and their work to get and upgrade a lot of their systems and how those are rolling out to customers. So we have positive outlook for Allscripts going forward. We really see them having made the necessary investments and finding, closer communication with their customers to really find additional traction in the space and do what needs to be done to be a real success in the health IT services market. So I'd like to call out some of the growth leaders and from that chart as well. So we talked about CGI and a lot of what we're seeing there. There was also, they did benefit greatly from a engagement, and we feel that in light of the healthcare.gov contract moving over to Accenture as of April 1st, CGI really needed to find some replacement revenues in order to keep their intensity in this market. Winning the contract with the National Health System in the UK, while not a one-for-one exchange, definitely provides them with that traction outside the US market. And they have also made some wins with CMS for some specific work, renewals and such, that will help sustain them and keep this as a strong area of practice. Infosys is a company that we didn't touch on a moment ago, but wanted to call out here as a strong growth leader. Incidentally, they had a large-scale contract with the District of Columbia that they benefited from. This was a major driver for their overall health IT services revenue. With the most recent results available to us, the 1Q, they registered a contraction in this overall business, and it has to do with a gap. With the end of the contract, they pulled through all the revenue that they were going to get from the District of Columbia, and that in turn created a drop in revenue during the first quarter. They have since, signed an expanded agreement and will be doing additional work for the District of Columbia, but they are highly reliant. The size of this overall business, they need to diversify in order to keep consistent growth going for the overall market. And finally, the recent addition of Epic to the overall benchmark. They immediately jumped into one of the top spots in terms of overall growth. And this is based on our evaluations of the business. They've been very effective in securing those large health systems for their overall electronic health record, hospital management, those systems. And the majority of their IT services work concentrates nearly exclusively on the high-level integration work that is associated with these systems and the consulting and systems integration partners that are being used to actually roll them out. I'd like to turn to the margin leaders that we had in the fourth quarter and how that they came to really have a strong role in the government. CPSI jumped to the top spot. This is a smaller company that focuses exclusively or near exclusively on your rural hospitals, and their ability to lock up this part of the market, especially with the increased demand for meaningful use, companies, these providers needing a reliable resource. This is a known quantity for them, and this has allowed them to really be effective in delivering the IT services that they bring along with their packaged software solutions. And we expect to continue to see CPSI performing well in this category. HCL, as an India-based contractor, it does benefit from moving a lot of its work to lower cost delivery. This is primarily, we're seeing a lot of it effective in the pharma category or life sciences. And this has been a strong area for HCL to develop. However, it is a smaller player in the overall scope of things, and they do have limited exposure to the provider space in the U.S. and internationally. And we anticipate that they're going to be moving into that, and it will be margin dilutive as they make those investments. And finally, Epic. Again, this recent addition to the overall health IT services benchmark immediately seized the top position, and primarily driven off of its concentration on its implementation of its own software. The IT services branch does not, in our estimation, diverge from that program, where it is focusing nearly exclusively on the advice, the planning, and the overall architecture of implementing its systems, and then working closely with the MNCs or India-based companies to actually do the integration work to get these in place for these large-scale hospital systems. The overall theme for these companies, though, is that it's the niche player that is able to really secure the overall best margins in the market, and that has to do with the tight area of focus and concentration. Our more general players have not as high in the margin category, but they tend to have a more diversified revenue stream, and we don't see as much fluctuation with them on a quarter-to-quarter basis. So what are some of the overall trends for each of these categories that we saw across the past year and the past quarter? Well, in the payer category, it's the interest in those health benefit exchanges. I think the level of interest that came about as a result of the widespread implementation of the health insurance exchanges as part of the Affordable Care Act is directly translating into employers seeing this as a kind of insurance delivery mechanism that can be used on their side to lower costs and improve satisfaction with the benefit. Providers, the big trend that we're seeing around them is the idea of interoperability, and we'll touch on that later on in the discussion. Life sciences, the idea of big data and analytics is central to so much of the work that they're doing these days. The age of the blockbuster drug is over, so identifying those key markets or niche drug therapy areas where they can justify the cost of bringing a new drug to market is certainly an area where they're looking to health IT service providers to give them the capability to help identify and track into those markets. And then the public sector space, federal, the modernization of the overall federal healthcare systems is going to be a big area. The Defense Healthcare Management System Modernization Project is something that we feel there's a lot of interest in across the health IT services benchmark participants, especially those with a background in government. And looking at the state level, we're seeing more and more of the companies that have a background in this. Your HP Services, Xerox, and CSC, for one, with their MMIS work that they've delivered consistently on, they're seeing and benefiting from the expanding spending going on at the state level. So looking to some of the key strategic pieces that happened during the last quarter, let's look at some of the M&A activity, alliances, and portfolio expansion that were carried out by some of the selected players that we had in the benchmark, and how those are indicative of what we're seeing in the wider marketplace. So from acquisitional standpoint, both CSC and Dell Services, these weren't nearly exclusive to the health IT services piece, but they did have strong areas where they were actually diving in and have a strong level of application in health IT services. CSC with Service Mesh, this is going to bring has brought to CSC a large instant capability around managing and blending various cloud networks. This builds on CSC's established private cloud operation systems, and we find that that's truly going to resonate with the provider network as they move more and more to the utility computing model, where they'll have access to public and private cloud services to drive and deliver those IT systems needed for their individual care providers. Also, Dell Services with StatSoft. This was done right after the end of the quarter, but this gives them increased analytical ability around large data and also data visualization. We feel that this is, as far as population health management and fraud detection, these types of analytical tools and then the data visualization will be of great value and allow Dell Services to make further inroads into the health IT services space. Alliances were also a key component for many providers, and just to call out a few of these, McKesson with Red Brick Health, they'll be working together to develop some additional efficiencies in delivering healthcare, especially for the idea of patient engagement as that begins to gain traction in the marketplace. This will provide those tools for individual healthcare providers to, or the insurance companies, to engage with their members and make sure that they are, pursuing those healthy lifestyle choices that would keep their own premiums down. Dell Services with the Cleveland Clinic, working along with the overall to roll out EHR to the general area. We're seeing that there's a lot of interest in the overall Lake Stretch area, so from Buffalo, Cleveland Clinic, and in Pittsburgh. We'll touch on that with CSC, but this is an area of investment, and we're seeing the formation of a medical hub, and I think Dell Services getting in more closely with the Cleveland Clinic is a good strategic move. And finally, IBM aligned that with Ohio Health and implementation of technology just for rudimentary things like hand washing. This is just an overall baseline for additional insights into how to improve healthcare with very small pieces. And this is something that not just from the provider's standpoint, but also from the patient standpoint, patient engagement, having those small adjustments that can be made in individual behavior that have a lasting impact on overall health and wellness is a piece that more and more providers or more vendors are looking into, providing tools to providers, insurance companies, and life science companies. I'd like to turn now to some of the key developments or service announcements. We touched on CSC and the opening of their Pittsburgh Delivery Center. This is a key component, in our opinion, of CSC finding a strong anchor point in the growing medical hub that is becoming along the lake shore between Buffalo, Cleveland, with Pittsburgh as a role in that direct line. McKesson rolling out another addition to their Paragon system that focuses exclusively on ambulatory care. This is a move to provide the tools for the increased use of ambulatory care. Healthcare payers are insisting on or looking at the cost benefit of having care being provided in ambulatory clinics and care facilities. And this is becoming, managing this is going to be a larger piece. McKesson made the investment to get out and be a clear player in that space. And then NextGen turned around very quickly on its acquisition of Mirth in the prior quarter, bringing a capability in their share product that allows providers to generate information and move that out to other spokes in the overall healthcare delivery community. So more communication with your community health systems, your stakeholders in individual's care, individual caregiver, a pharmacy, what have you, in the wider healthcare ecosystem. Products like this are going to increase not just interoperability, but the level of communication that's going on, and really help accountable care organizations get legs in the next year. So what do we see in the coming year, and what are we looking most closely at in the coming quarter? Well, first of all, we're looking primarily at interoperability and how those systems are migrating from the old siloed systems. In many cases, you had departments running systems that were not compatible with other systems within the same hospital. Having an increased level of interoperability between those systems and then just more general electronic health record systems, being able to draw information from each other is a big area of investment for health IT services companies, being able to provide that increased level of liquidity as far as healthcare data goes. And this is something that U.S. lawmakers are really honing in on. They see this as, the return on their investment in health IT with the HITECH Act. They would like to see and are looking to accelerate the rate of information exchange and how quickly that we're able to benefit from that in the U.S. The Commonwealth Alliance is a key example of how this is being done at the private level. You have Allscripts, Athena Health, Cerner, CPSI, and McKesson, Greenway, and SunQuest all participating in this, trying to find the correct level of standards and creating those standards independently of any kind of legislature or legislative mandate. And I think that this is moving ahead of the curve in many cases. But noticeably absent is Epic, and I think that that's going to be an area of with their large, having secured such a large portion of the market. So watching this play out will be something we'll keep a close eye on, and as far as how interoperability is going to progress, and if it's going to come from within or if it's going to be a piece that's being imposed upon the industry as a whole. The next major trend, and I think that this is both an offshoot of what's happening in the industry and also a central driver, is the move to consumer-driven healthcare with the patient at the center of healthcare and how that's the level of individualized care that's being viewed, how it's being put out to the market, and also certain mandates as far as the movement to outcome-based remuneration and paid per performance, moving away from fee-for-service or volume-based caregiving. And the overall mind shift that's going on in health IT and the healthcare in general is really something we're going to be watching for some time. And it's really going to provide a lot more of the level of improvement of lifestyle, improvement of healthcare delivery, and also amount of personal choice that's going to be pushed down to each individual to take responsibility in their own healthcare experience. More and more, this is going to bring more and more choice to consumers. They're going to need to have a greater insight into what the ultimate cost will be. With the introduction of health benefit exchanges, patients will need to understand those costs because it's been shown that they will have a higher degree of responsibility when they're electing for their own specific health plan. They're going to be a lot more price conscious of healthcare going forward. But at the same time, there's going to be a need for greater engagement. So you have individual consumers understanding and having access to healthcare advice, maybe not going to see their doctor more often, but utilizing mobile health, utilizing telemedicine to ask those questions. We anticipate that pharmacists will become a much larger piece in the overall market with them at those retail points where people can engage with them, ask their opinion, and then either be referred or make a decision whether to pursue it or stop there. So I think the way that healthcare is being built out around this patient centrism, those customers are vendors that are able to put the tools in place for both providers, payers to have that higher level engagement. You have McKesson with the alliance with Red Brick. They have the MyCare Plus. You also have Allscripts building out their own Follow My Patient a tool for case managers to maintain that high level of patient engagement and make sure that they're following through with their treatment plans, and ultimately make sure that you have those improved outcomes and you don't have that hospital recidivism where people are coming back in and then it lowers the amount of reimbursement or negates reimbursement altogether for the treatment that was delivered. Finally, we'll look at the general IT service piece and how this is really going to step up in the coming year. Cloud is going to become more and more ubiquitous across the marketplace. To an earlier point, providers primarily are looking to operate within their existing health IT budgets or their IT service budgets and get more bang for the buck. And a large way that that can be done is employing cloud and you only paying for what you use for around, and the management of endpoint devices, having that all
Hi, everyone. Can you hear us now? Okay, we're using my cell phone, so if the audio quality is a little bit bad, I apologize for it, but we're trying to cobble something together for everyone so Joe can finish up. So I'm going to pass it back to Joe.
Thank you, Allison. So just I don't know when we lost you, but I was talking about the more general trends. We're on slide 18, looking at cloud and analytics cybersecurity. Finally, the cybersecurity piece was as far as needing more and more custom fit for the healthcare IT service community. And I think that this has to do with, balancing the high level of fluidity expected for general trending health information, but at the same time protecting individual privacy for patients. So that's with HIPAA compliance, but also in that regard, having the ability to data governance, who can see what, and being driven off of identity, your role within an organization or within a larger framework. And this is going to be critical to have the effective stand-up of accountable care organizations, having that strong and effective cybersecurity policy in place. So health IT service vendors that have a strong background in that will definitely see increased traction as we move through 2014. So that sums up my more general overview of the report, and I know that there were some Q&A that we wanted to get to at this point. So without further ado, let's just drop right in.
Okay, thanks everyone that bared with us through the audio problems. So let me get to these questions because I have to go through everyone telling me they lost audio. The first question actually is a two-part question, so just bear with me. The question is, are you picking up on any cloud analytics-specific software combo differentiation plays for healthcare coming to the surface? Any top-of-mind key niche vendors or traditional vendors standing out? And tying back to the first question on chart 17 on opportunity, and I'll go back to 17. Cloud mobile linkage, were we seeing cloud big data analytics swelling as well?
Yes, we are seeing more and more trending toward the combination of having your analytic capabilities based on, as more information is moving to the cloud, especially in the provider space, and they're taking greater advantage of the flexibility that it brings about. Adding that analytical layer is something that we're seeing more and more. Specific providers in that respect, I know that Deloitte is one player that has really been building out its analytical capability. The partnership it has with Intermountain produced the healthcare, the miner capabilities that it has. I believe those are called the population miner and healthcare miner, or health solution miner capabilities. And those are the vein, and we do see those coming up more and more across the marketplace. That's the one specific example that immediately springs to mind, but that's something I would welcome following up on and continuing a discussion around that whenever possible.
Okay. The next question, we had a couple questions with the same person. Are you seeing any product innovations for cloud first or prem with secondary solution in the cloud? For example, next-gen cloud-only delivery of new solution or prem?
Next-gen is a good example. I think in addition to next-gen, you're also seeing Allscripts and McKesson building out more of their overall offerings to the cloud. And I think that this is really being driven by the transferability and the from provider to provider, being able to make those upgrades. I think from a standpoint of having differentiation at the electronic health records piece, I don't think that there's a whole lot of differentiation with the customization that goes on at those higher levels. So it's really being able to have the nimbleness that you need from using that information. And so from that standpoint, I think that we're going to see more and more of these systems moving to near cloud exclusive offerings.
Okay, the next question, any buzz around, and I pronounced this correctly, I apologize, Caradigm in the market yet? It seems there's quite a Microsoft and GE combo play.
That's a company that we don't track directly. But that there is a rising amount of interest in the solutions that they're bringing to market. That's something that I would welcome, looking into more deeply and then following up with you directly.
Okay. we actually have a similar question in terms, I think we're going to have to keep following up. We had a question about PwC and why they're not in the benchmark, and if you can share some of your opinions on PwC healthcare.
PwC, at HIMSS, they were a large presence, and we had, TBR had several meetings with them and gained a lot of insight into the thought leadership that they're bringing to the space. As far as having them directly in, their IT services piece is growing very effectively. So, as far as having them actually within the overall benchmark, that's of course something that we'd be interested in discussing. That being said, the amount of innovation that they're bringing in and working with the payer community and the provider community and making those next level investments and how healthcare needs to be viewed increasingly through the prism of almost a retail type view is really going to allow them to bring their customers to be market leaders in our opinion. We're seeing them as putting forth a lot of interesting new ideas around how healthcare can be developed in the marketplace, and we are aware that they are building out their actual IT services capabilities, so we'll be following them very closely in the coming year.
The next question we had come through, how is the payer adoption of cloud-based solutions? What are the areas, for example, CRM systems, in which they are investing?
From the payer standpoint, as far as having a closer idea of what's going on with their individual members, I think that speaks to what McKesson is doing with Redbrick as far as having a higher level of individual engagement with the members, knowing who's covered in their plan, what's going on with them, their medical history, and anything else that's happening with them, to have that higher degree of touch point with these individual customers and making sure that they're aware of the services and benefits that are available to them to improve their own personal health care. From a translating CRM into that capability, I think that's very interesting. And then you're also seeing other players, using ERP type systems to move into the space as well. So I think, from a provider, office management standpoint. So as long as we're seeing the strong level of expansion in IT services spending and revenue being generated by these companies that we cover in the benchmark, there's going to be more and more innovation coming into the space as far as having that higher level of patient engagement or member engagement in the overall marketplace.
Okay. The next question we have, what are the areas in which HICS vendors are betting on to sustain or improve their revenue growth?
Telemedicine, I think, is one of the areas where solutions need to be configured and brought to the provider community. I think that many of, as far as continuing and maintaining momentum in the overall expansion of the provider space, that's one key area of growth. And then, of course, the emerging markets and how that's going to apply to mobility health. With less developed physical infrastructure, the wireless ability to have healthcare and healthcare services being delivered over a mobile network is certainly going to be a true area of investment. And we're seeing the really forward-thinking health IT service vendors looking at that and making those early investments to make sure that they have the capabilities and solutions in those spaces.
Okay. We got two more questions that just came through. Do you have any examples of demonstrated traction in patient engagement solutions?
The one that springs to mind and is the Allscripts follow my patient engagement. They've had secured 2 engagements with that, I believe, one in Illinois and I believe the other one was in Ohio, but I can get back to you on that. But that's the first one that springs to mind. I think that the early signs of case management Allscripts is building this on the DB Motion technology that they acquired, and I think that we're going to see more and more of the high level of touch, providers needing to follow up with patients after they've left the hospital as a required piece under the Affordable Care Act, or just seeing that as an added benefit to improve that customer experience. And I think that that's, the overall area that we're going to see more and more investment coming into is not necessarily viewing the patient as a customer, but making sure that, hospitals are aware and looking to improve the overall experience for these patients when they're there, so that they will, in turn, be return patients or advise friends and family to use that facility.
Okay. The last question we have right now, will the delay in cutover to ICD-10 affect the health IT services market?
I think that it certainly will. I think that some of the, maybe the India-based players or your other, some of your more traditional ITO players that were looking to do some cutover work may have been looking at the ICD-10 deadline. For staff augmentation, they are going to be able to come in and really help make it happen and make sure that they were ready for the cutover, the testing that was going to be conducted this summer. With the delay, I think the sense of urgency is going to be abate to a certain degree, so you're not going to see spending, and also the level of pricing that can be charged for those services is going to drop off as well. So I think there's going to be some pullback in that area where there may have been companies, especially your HITS vendors with access to deep resource pools, may have been counting on a little bit more of a bump in that regard, and not seeing it this year. But in that same vein, they put it off for 1 year, and in many cases, I think the customers that were procrastinating and running up against the deadline will be running up against the same deadline a year from now.
We don't have any additional questions in queue, so with that, I'm going to sort of wrap up. I do apologize for losing audio. One of the drawbacks, unfortunately, is that we lost the recording of the entire webinar. So what I'd like to do, I know a lot of folks kind of go back and share this within their organizations. We will be sending the slides out to everyone by tomorrow. If you would like, if there's other people on your team that you would like to have a conversation with Joe around this, please reach out to me, send me a note. I have a couple of requests already for follow-up conversations. We'll talk to a team if you want to get folks together, since they can't listen to the recording of the webinar. So please do reach out to me for that. Couple quick things, as I always, many of you who have been on the webinars before, share with all the social media links. So I encourage you to follow Joe at JD Wallet, as well as TBR Inc. And then I've shared all of the, unfortunately YouTube's not going to work this time, but the slides will be on SlideShare as well as being sent out to you. And to encourage everyone to join our community on LinkedIn, we are posting all of our special commentaries, our free research, as well as infographics on our community on LinkedIn. So please do join us there, and look forward to those conversations. I'm going to leave the chat box open for another couple of minutes in case there's any last-minute requests for anything. On your way out, if you could please, aside from the technical difficulty, we do have a survey on how good the presentation was, how valuable the presentation was, how good the presenter, and if there's any other open-ended feedback. We do collect that, and we look at it and change our presentations each quarter to match what your needs are. So I do appreciate if you take the time to fill out that survey, and we'll use that, and Joe and I will go over that. So with that, I think we're about ready to wrap up. So thanks, everyone, for your time, and thanks, Joe, for the presentation, and we look forward to speaking with you all again soon. Have a great afternoon, everyone. That pisses me off.
So it just cut out?
Yeah.
I mean, I was looking at it. It looked like the line was still open and everything. It's just like...
And when I dialed back in, they still couldn't hear me.
Yeah, so that's...
And it's not...
And it's not like you're using this electronics or whatever it is.
I should probably turn the phone